All right. Welcome to an episode of Pathway to Purpose. I am super excited. I've been thinking about this for a little bit because I had an amazing conversation with Dr. Matthew Stanizzi, and he is a urologist, a medical director. He's the clinical urologist at Dartmouth, right? Is that up in New Hampshire?
Yeah, it's a Dartmouth affiliate. So you have Dartmouth, which is kind of the big, institution that most people heard of. That's one of several satellite facilities throughout the state. So I work at one of the satellite facilities in Keene, New Hampshire, Chester Medical Center, and there I work as a urologist a couple days a week, and the other 3 days a week I work in my health and wellness practice.
That is awesome. And you have, and it was interesting because a friend of mine introduced us. We wound up getting on the phone and we just had this amazing conversation. You were speaking my language, and some of the things that I'm passionate about is health and wellness, especially in this country, things that we've been faced with. So you do have a health and wellness office, and it's called BioRestore. What kinds of things do you do there? What is that about?
Yeah, so I own and operate the BioRestore, New Hampshire, which is one of a couple of locations. The other locations are not owned by me, but I serve as like a medical liaison to those other two locations, which are one is in Connecticut. Actually, the other two locations are in Connecticut. So up in New Hampshire, over the years, it started off as what I thought would be kind of like a hormonal health for men or men's sexual wellness kind of practice. Much like people that kind of go into the world of entrepreneurship, you kind of realize that what you think you're going to do when you start, it actually turns into something different as you go. It really turned more into like a total hormonal health for both men and women. And the importance of to me of really focusing on like the foundational aspects of human health are really what would then lend itself well to hormonal optimization. And I kind of found that you have like two kind of index patients, right? You have the person that's kind of got all their stuff dialed in, but something's still wrong, right? And they're like, I don't get it. Like I eat well, I exercise, I get good quality sleep, but like something's off, right? And then you go through their lab work and you try to figure it out, and you're like, oh, this looks wrong. So let's see what we can do to fix that. And then they come in like, oh my God, game changer, right? Then that same person, they're telling their buddy and working out in the gym or whatever, like, hey, man, I went on some hormone therapy and like game changer. And that person rolls in and it's got nothing dialed in, right? They're like diet's garbage. They don't understand the foggiest thing about what they should be doing with their life. It's just like rat race from the time they wake up to the time they go to sleep. And they're like, yeah, but I heard testosterone replacement is like great. It's like, salvation in a syringe. And I'm like, okay, we got some work to do. So it became very clear to me that like we needed to spend a lot of time. And as I've gone through the years, I've actually my initial intake visits are like 90 minutes long. And I would say easily the first hour of that is just like, let me hear about your life, what you're doing day in and day out, and what can we do to make changes in how you live before we talk about how we can make changes in other things. So whether that other thing is hormonal optimization, and for men it's often testosterone, for women it's a combination of estrogen, progesterone, and testosterone. Thyroid management is an option of that. Or is an option that we offer. We can use Simorlin, which is a peptide that helps boost growth hormone levels, and we find which is the right fit with those different services. And beyond that, we have some other things. We have some pelvic floor health stuff that kind of piggybacks off my experience as a urologist. We have some aesthetic type stuff. So I have this thing called an M Sculpt, which is helps to improve body composition and muscle mass. So it's a really a functional kind of device, even though it's kind of billed as a like aesthetics equipment or body sculpting, um, and other things for sexual wellness. And that's kind of the general scope of what we do. I was like, let's find all the things that I think benefit patients, but people either can't get it or won't be offered it in the traditional world of medicine. And let's bring those in so that people can have access with a person that actually cares about providing tips and tricks and a pathway to wellness, rather than just being like, hey, we're just trying to drop ship you some medication and make a quick buck.
Wow. So are you considered a functional medicine doctor, or I know that that's the term out there, like, oh, I'm seeing a functional medicine doctor. Tell me a little bit more about that label, but I also wanted to hear how you've gone from urology, and you still do surgeries, you're still in the medical game, like the
Yep.
traditional medicine. How did you like what inspired you to evolve over this as well?
Okay, so question one, what is a functional medicine doctor? I think it's a pretty broad term, but I think it's generally someone that looks at the whole person and everything that affects that person's health and wellness, um, rather than someone who looks at someone from like an organ-based pathology kind of standpoint. So, for me, it's like yeah, traditional medicine and the way it's kind of designed, and there's a lot of history behind how it got there, uh, generally is not a healthcare system. And I tell my patients, we don't really have a healthcare system in this country. We have a medical system that focuses on disease diagnosis and management, and things are paid for typically by insurance or the government when medical necessity is discovered, and then things kind of kick in. But if you're looking to optimize your health, that's a different kind of set, and oftentimes you're not going to get that paid for. You have to invest in your health on your own, which again, you can argue the merits or the lack thereof of that strategy, but that's what we deal with. So functional medicine doctors often work outside of the insurance model because they have to work in the world of health optimization. um, I think the sort of the easiest way to describe it is you're looking for all the things that the body needs that it's not getting, right? And then you start figuring out what are the things that the body is being exposed to that it doesn't work well with, and simply try to get the stuff that the body needs in and get the things that the body doesn't need out. And if you do that, the body has some biologic intelligence where a lot of the hard work is done already, right? And then how can we support that through maybe supplements? Um, how can we support that with hormonal support and using pharmaceuticals in a strategic way with the idea of optimizing your functionality so that you live the healthiest, most functional, hopefully longest life you can.
Gotcha. So what got you there? What got you from there to there? Or part
Yes.
way? How's that?
Yeah, a lot of people find themselves in the functional medicine space because they have their own personal health crisis. And I've had my own health issues over the years, but I wouldn't say I had a health crisis and had to figure it out. For me, the crisis was really a crisis of career, right? Where I watched the traditional urology practice that I was in really start to get, um in my mind, damaged by the administrative bureaucratic overload, changes in the healthcare system that kind of stemmed from the Affordable Care Act, introduction of EMR, and really like just the practice of medicine when I started to maybe like 5 years ago, just inherently there was a shift and it just became hard, right? And that's why you see doctors and nurse practitioners and people kind of leaving in droves because everyone's just getting burned out and there's no control. Like you do not have, for the most part, control over your practice when you're working in a large medical system that's very regimented in how they do things and has very little flexibility. So I felt like this career in traditional medicine, I don't think is going to serve my long-term professional or personal goals. And more importantly, I was like, I don't really feel like it's serving my patients that well. Like, uh, if there's like an acute problem, you can be the person that comes in and does wonderful things, right? Chronic problems, it was like I was hitting my head against the wall. Like, there's got to be a better way, right? And I remember I was on call. It was a long weekend. I was up all night. I got called back into the hospital, and I don't remember what happened. I think it was like I got called for a surgical consult, and whoever was primarily responsible for the patient, like, was feeding them, right? So like I came in, I'm like, this person needs surgery, and I can't operate on this patient because for whatever reason you thought, hey, let me call a surgical consult, but then feed the person at the same time. And for those people who don't know, you can't go to the OR in an empty stomach unless it's a blatant emergency, which in this case, it was more like an urgent thing. So like the whole day got pushed off by like another 4 hours and 5 hours. And I was like, this was kind of the straw that broke. I felt something in me break. And I was like, I can't do this anymore. Like I would rather like give up my whole career or sell my house and all my belongings and like find a cabin in the woods than keep doing it this way.
Hmm.
And that was the point where I really needed to like make a shift and make a change. And and I said, I think there's a better way to do things. And that was the concept of me sort of saying, like, let me start a BioRestore licensed location here in New Hampshire, because I'd already had some exposure to that kind of concept by working with this other practice as their sort of medical director at the time. Um, and yeah, and then that's where it went from there. And I went deep into kind of initially what I thought was testosterone replacement, and then, not to share too much, my wife, who was actually diagnosed with premature ovarian failure, like,
Hmm.
in her 30s, and it was like we had fertility issues, and like she started to have these things that she was like, I think it's hormonal related, but my primary care doctor says, "Oh, it's you just getting older and you got to deal with it." And my GYN said the same thing, and my endocrinologist has also said the same thing. And she's like, "You prescribe testosterone to guys. Why can't I get hormone replacement for me?" And I went into the same paradigm that I've been trained in like 20 years ago. Like, well, that's because estrogen causes cancer and doesn't really protect your heart, and it's not a good, and it'll cause breast cancer, and like we don't want to do that. And she's like, "Yeah, but my my family who lives in England, like they're getting hormone therapy, and I have a friend out in California, and they're getting it. So if they're getting it, why is that happening if it's dangerous?" And I was like,
Hmm.
it's a good question. Like, maybe I need to do a little bit of research and start retraining myself on what I think I know, right? Approach this with some curiosity, and that then opened the door into like the idea of functional medicine and hormone replacement for women, and how is it that what I was taught may not be entirely correct, and maybe I need to start educating myself if I'm actually going to be of value to patients. And like in post so patient zero for hormone replacement therapy under my watch was actually my wife. And then now I actually would say at least 50% of my patient panel are women seeking hormone replacement therapy that can't get it from more traditional sources.
Wow, because of the bureaucracy here in the States, and kind of the regulations, and the Affordable Care Act and some of those repercussions.
I think it's less about the Affordable Care Act. Like the Affordable Care Act just put a bunch of stuff saying like we're trying to improve quality, right? And the result was is that created bureaucracy, and bureaucracy creates inefficiency, and inefficiency creates frustration on the part of the patient and on the part of the provider. But hormone replacement therapy for specifically for women, premenopausal or perimenopausal or postmenopausal women, like a lot of the resistance to that goes back to something called the Women's Health Initiative, which was this study that came out in the early 2000s. I remember I was a medical student when it came out, and it was like big news. It was on network news. Everyone was talking about it, and it was like, hey, hormone replacement therapy for women causes breast cancer. So guess what? No more. And it
Mhm.
was like overnight, the idea of hormone replacement therapy for postmenopausal women disappeared because everyone was like, above all else, do no harm. And it was based upon data that was not necessarily the best quality data. I mean, it did answer a very specific question, which was in a patient population that's on average 10 years after menopause, if you use estrogen or conjugated estrogen from horse, typically like conjugated horse estrogens, and synthetic progesterone like substances, what's happening, right? And the answer is you actually see there's a not particularly benefit in terms of cardiovascular health in that population. And we saw what was the big news was a 25% increase in breast cancer risk, right? And so that sounds horrifying, right? And if you don't do your homework, you're like 25% increased risk of breast cancer, done, right? But the problem was is they didn't say, well, wait a second, what is the absolute risk of breast cancer, right? Because the absolute risk of breast cancer wasn't 1 in 4. The absolute risk was 1 in 1,000, right? So if you go back to the data, it's like you had a control group and you had your non-control group. In the control group, that didn't get estrogen, 4 out of 1,000 women got breast cancer because breast cancer happens, right? It does happen. In the treatment group, 5 out of 1,000 got breast cancer, right? So that 4 to 5 represents a 25% increase in the amount of breast cancer cases. But the total amongst the whole population was 1 out of 1,000. So the result was is that you basically told for every 1,000 women that had hormone symptoms that would be considering estrogen and progesterone and bioidentical or hormone replacement, that they couldn't have it because you're worried that you might cause one breast cancer. And we didn't allow women the ability to have that conversation and say, yeah, but estrogen has other benefits, right? And progesterone has other benefits. It helps with sleep, it helps with skin, it helps with potential bone health, and bone density. And what's the overall risk versus benefit may still be in favor of hormone replacement therapy, but that conversation got completely washed away by the 25% increase. And as a result, there was like an entire generation of women that were basically like, no.
Wow.
Unfortunately, medical people are becoming more aware of this and are beginning to warm back up to the idea of providing hormone replacement, but it's not like common. And that leaves the sort of need out there that I'm trying to fill when I see these patients that are looking for this type of therapy.
Wow. That's awesome. And it kind of gives you, it kind of, you kind of got to do your research, right? And you're a physician, right? Did they teach you this stuff in medical school? Did they teach you, hey, this is the foundation of health? I have a lot of friends that are physicians, surgeons, because I grew up in the ranks in the hospitals and all that. Did they teach you this stuff as a physician?
No, because if you look at what medical school's first year is like, how does the body work? It's like it's normal physiology, anatomy and physiology, right? The second year is how does it go wrong? Right. And like the third and fourth year are like, well, what can you do in terms of tests and, in the real world to discover what the pathology is and come up with a treatment plan that involves a pharmaceutical or a surgery. Right.
Yeah.
But like that's disease management. And I think the problem with medicine is that we have gotten really good at acute disease, right? Like if you look at the things that are acute, right? You're shot, right? There's a trauma, right? You have a burst appendix. You have an acute infection, right? Surgical type interventions, chemotherapy for cancer. Like these are like honestly like the miracles of modern medicine, and what made medicine it has made medicine amazing, and why people are like modern medicine is fantastic, right? I don't have to die of dysentery anymore.
Yeah.
Yay, right? The problem is that we're so enamored with the miracles that we created in the acute disease setting, we kind of made the natural assumption that we would be able to apply that same kind of thought process to dealing with chronic disease and it would work as well. And it doesn't, right? And it certainly doesn't in an environment where there's a lot of stuff, whether it's chemicals that are allowed into the country that are not allowed in other parts of the world, or the declining quality of our food, that really start to wear on our ability to stay healthy. And that's assuming you're even trying to do everything right. Right. So you look at it and say, okay, like what are the things that really establish the base, the foundation of human health? Right. And I would give people four, right? And so the general term when I'm first meeting someone is we have to talk about your diet, right? And that includes supplements. We have to talk about exercise and how often are you doing it, the different types of exercise and how to make sure you're not overtraining or undertraining. We talk about sleep quality and sleep hygiene. And we talk about stress management, right? And those are kind of general terms. You can go a little deeper with that, right? You can look at like stress and be like, well, maybe we're talking more about mindfulness and your sense of connection to self and your family and your society and your God, right? So we can go levels deeper with each one of these things as we go. But when you think about it, right, and I take a step back and say, well, what was my training? There was no nutrition training. There was no dietary discussion in medical school at all, like maybe an afternoon, right? We didn't talk about sleep. I mean, maybe we talked about like the different levels of like, brain waves, like beta, you're awake, alpha, you're kind of, calm, your delta, you're sleeping. Like, I mean, you talked, but it wasn't like, let's talk about how to optimize a person's sleep pattern and sleep behavior, right? Exercise, forget it. And in fact, if I went even further, the actual process of training to be a physician is bad for your health, right? Like you
Yeah, it
literally
is.
do all the stuff that you shouldn't do. It's like you're working crazy hours, you're chronically sleep deprived, you're totally stressed out, you don't have time to exercise, and what you eat is down in the cafeteria what you can grab on the way. So for like 10 years, right, when I was in training, I was like abusing my body. And fortunately, because I was going through that process when I was like in my late 20s and 30s, I had enough biologic reserve that I didn't kill myself in the process, right? But then you walk out being like, well, now I'm a newly minted doctor with all this knowledge, and you have knowledge about disease management, but you don't have knowledge about how to foster a good foundation for human health. And that's where I think a lot of physicians are even unaware of um, their own shortcomings in that, right? And even if they do know their shortcomings, the way that medicine is set up, they don't have the time to take with patients to really counsel them on these aspects. And we just assume that people don't care. Like my patient's lazy and wants to eat, crap. And like, why do I want to take time when I got 10 or 15 minutes just to get through the bare basics to try to counsel this person on, hey, have you ever considered doing this, that, or the third that might actually help your health? There isn't the time. I mean, again, I take 90 minutes with my patients because that's what it takes just to scratch the surface. You cannot do it when you got a 20-minute visit and you got 30 patients to see in a day.
Yeah, it's impossible. And I'm in the healthcare system and I've been involved and I've been a patient. And it's funny when you were sharing about your medical school and like how you abuse your body. I used to work in the ICU a lot when I was younger, and the residents and the fellows and all those guys. I'm like, I don't know how you guys do this. Like they're like up for like almost 48 hours. They're making life decisions, you know what I mean? And they got the room in the back. Hopefully they don't get called, but somebody's calling them. And I'm like, man, this is this is tough. But one of the things, and I shared with you, I was diagnosed with a brain tumor, and I'm blessed to be in this country where I go to a large facility in this state, and there's a guy that's an expert at surgically intervening into my skull and removing that, like you said, right? Like this is the stuff they're great at. So I go afterwards, obviously after the surgery, I'm done with the neurosurgeon. They put me into a neuro-oncologist, super amazing guy. And he goes, I've studied your tumor, and we haven't seen a lot of these around, and so I just want to do a study. So he's really smart. And so I have these questions. I'm like, oh my God, how did this thing get in my head? I said, should I be eating any different? Because you could eat whatever you want, you could do whatever you want. And I was like, listen, do you recommend like a keto diet, like with the brain? Like, what do you think? And so I was like game on in my own personal health. And honestly, you could listen to all kinds of people. Like I was like, the more I started to research, the more I got confused. And then when I put on social media my diagnosis, everyone's like, you got to go vegan, you got to do this. And then you hear about carnivore, and everybody loses weight on keto, and keto's been great for seizures for people. And then I have people that are listen to my stuff, and they're like all vegan, and I'm like, yeah, but I listen to some experts, right? And then when I see some experts overlap, I'm like, well, maybe this is a little bit of the truth, like a doctors or nutritionists or things like that. So what's your take? Because you're talking about foundation stuff. We're talking about these pillars of health. And I know you and I talked offline about this. What do you recommend as far as like, somebody's like, I'm in this to win it, what should I do?
So having the commitment to make the hard choices, right? Because choices of food that are usually easy, convenient, and taste good are going to be choices that are bad for you. So there always takes some effort. So a willingness to do something different is the first important part. So congratulations, you got a willingness. Now we have to figure it out. What I tell people is like, look, there is no diet that's great for everybody.
Mhm.
We're all individuals. There's so much bio individuality that you have to say like, I need to approach my dietary choices with a sense of curiosity. What would happen if, right? And then you start asking those questions, right? And so I try to encourage people not to let philosophy trump physiology. And what are things? So when people say, well, where the hell do I start? Right? Because we got keto, we got vegan, we got, paleo, we got, like, dirty keto, clean keto. Like, what are all these things? Like, maybe it's just go on Weight Watchers, right? And it's like, okay, let's start with the basics, right? One of the, sort of groups that I have is called Med Evolution. And and I like that word, medical evolution, not because we need to evolve medicine, but because medicine is best understood, or health is health is best understood through the prism of evolution. I have a podcast I'm working on with one of my friends, and we decided to call that the Evo Well podcast because it's the evolution of wellness, right? But again, I keep on using the word evolution because there is a need for evolvement of what our health system is at the moment. But if you start thinking, where did we evolve from as a species, you can start getting clues to what's going to work best for us, right? It's like mammals have been on this earth for what, 15 million years, right? um Hominids, 3 million, right? You go back to like the ancient, bipedal apes of that are now extinct, right? And human beings have been on this earth for like 200, maybe 300,000 years. Like that is a lot of evolutionary programming that is still existent in our bodies. And even though we've developed these bigger brains, our bodies are still functioning with like basic programming. So if you start thinking about like, well, how did humans eat for the first 200,000 years of our existence? And start with that. So if I say you want one word, paleo, right? Because you're eating what caveman ate, right? That's an easy way to start. Um, in theory, but then when you go into the grocery store, you're like, holy crap, it's really hard. Like there is so much stuff that isn't that. Like, what do I eat? Right. And we're so used to saying, like, well, you know, like there's nothing to eat if I do that. And the answer is like there's plenty to eat if you do that. There's nothing to eat that's super interesting, highly palatable, and that's been engineered for your taste buds. Like that's not available to you. But if
Right.
you want to talk about the basics of like a wide variety of vegetables, using tasty herbs and spices, trying to focus on proteins that come from healthy animal sources, right? And that's animals that are not factory raised on food that's unnatural for them. That's eating proteins that are come from animals that ate a normal natural diet for that animal, right? And you talk about fats, and you say like, oh, fats are gonna make you fat. Well, certain fats are gonna make you fat because they're terrible for you, but other ones are okay, right? And so fats that come from healthy animals generally have a better makeup of like omegas versus the, omega threes versus like the omega sixes, right? And uh, fats that come from plants where that fat is easily extracted or harnessed. So like avocado, olive, or coconut versus say versus vegetable oil or canola oil, which is generally doesn't work with our physiology. So you start focusing on like what are the things that like my ancient ancestors could have ate. Start with that and see where it takes you. And usually that's a really good starting block because you're cutting out most of the garbage. Right now, if you want to then tweak that and be like, well, what does keto feel like for a while? Okay, well, cut any of the carb sources out. So you're getting rid of like your fruits and your, root vegetables, any sort of grains that you might have consumed, and try that for a while. So like you start to sort of say like, what is it that's the best for me? Because some people go pure keto and the lack of any significant carbs, they feel terrible, right? And they need some carbs in their life. So, okay, so choose the carbs that make the most sense for you. Like focus on carbs that are healthy sources rather than highly processed grains. So you got to start playing with that kind of stuff. um a lot of people tout vegan. I am not a huge believer in vegan. I think it's possible, but I think it's difficult. A lot of people that are sick, not doing well, and they go pure vegan, they feel better, and it's less about what they're eating and more about what they're not eating.
Mhm.
And over time, the nutritional density of a lot of plants is lacking, so then over time there's a malnourishment that creeps in there, and then they start feeling bad again and they double down on the vegan diet. And it's like, well, maybe if you had some extra supplements or added in animal protein that has high nutritional density, you wouldn't be feeling this way. Um, Now, people that are like, I don't eat animals because it's a philosophy of mine as a religious thing. Okay, that's fine. Now you have to be really, really picky about where you're getting your proteins and making sure you get enough proteins and enough nutrients to support your biologic needs. You can do it as a vegan. It just takes a little bit more work than just being like, if I don't eat animals, I'm good.
Yeah, there's so much controversy around it, and I did some research on this, and come from your take. It's grass fed stuff. What's your take on fish? Like, I like fish, but then there's this whole thing on people like with all the mercury and all that. And then I talked to the guy at the fish market, and he goes, "It's not detectable," but he's probably trying to sell me fish. You know what I
Hmm.
mean? What's your take on that?
I think, it's like anything else. Everything in moderation is usually a good rule of thumb. So, you want to have fish, that's cool. But I mean, if you're having nothing but fish all the time, you may have problems with that. There are fish that have higher that are high in mercury, right? So you're like, okay, well, I'm going to do factory rate, farmed salmon. It's not less of an issue, yeah. But then you got 1,000 salmon swimming in the same small area with 1,000 of its buddies swimming in their own feces. That changes the quality of the meat that you're eating. So to me, I would rather get wild caught, right? And then use fish in combination with a bunch of other proteins and keep the variability up,
Yeah.
right? I
It,
mean,
mm,
and that's where you're likely going to avoid issues if you don't have the same thing over and over and over again, right? Notice I didn't say just eat your vegetables. I said eat a wide variety of vegetables, herbs, and spices, right? The variety is what prevents you from having a problem, right?
yeah.
As a urologist, I get the people like, oh, I'm totally healthy. I went on a green smoothie diet. Like, okay, what's in your green smoothie? Kale, spinach. I had some protein in there. Look how healthy I am. And I'm like, you just made yourself an oxalate slushy, right? What is that? That's giving you kidney stones. Oh, but I thought it was healthy. I was like, look, in no time in human history could you blend greens to make a drink,
You know
right?
what's
Like,
funny? I learned that from Dave Asprey, the Bulletproof Diet. He was the one that said, "Do not eat raw kale."
mhm.
And all that. And I think even spinach, he was talking about the raw spinach. That could cause some of those challenges. But yeah, that's a great kind of a great base for people because I think a confused mind does nothing, right? And sometimes people need you to walk through. You mentioned something in one of your pillars of health, exercise, right? And you said too much exercise. What do you mean by that?
Yeah. So I mean, it happens, I think, normally with guys where it's like a little bit is good and a lot of bit is better, right? So your body needs time to recover, right? It's that simple. Like you can't cause chronic ongoing stress and not have time to recover. So when you're younger and you have a ton of testosterone and a ton of growth hormone and your genes are all turned on for like maximal like tissue repair, like you might be able to go to the gym 7 days a week and work out an hour a day heavy lifting and be fine, right? But when that same person is doing that in their 30s or 40s and they're wondering why they're sore, can't get a good night's sleep, and their cortisol levels through the roof, it's like your body thinks it's at war, right? And so sometimes when I have those conversations, I'm like, you may actually be overtraining. Like you probably don't need to exercise that much. And yes, exercise is good for you. Like anything else, like water is good for you too. Stay well hydrated. But if you drink too much water, you can get water toxicity, right? Like that's a thing. You dilute your blood because you're drinking too much water. And similarly, if you over exercise too much, it can start doing damage. So I say like, look, and usually those are the same people that don't do any sort of like mindfulness or meditation or anything like that. And I'm like, here, this is what we're going to do, right? Instead of working out 7 days a week for an hour a day, we're going to work out 3 to 4 days a week for 45 minutes a day. And that time I just freed up for you, that's where you're going to start your morning routine and you're going to start doing a mindfulness practice, whether it's meditation or personal growth or like praying or whatever, because that's going to get to a point where you can start to quiet your mind. So you're going to exercise your mind in the same way you exercise your body. You're going to do both in tandem and you have a much better balance.
I love it. I love it. I've learned that too recently. I listened to Dave Asprey and he says you don't need to exercise that much. Your body doesn't need it as much. And I started to take that into account because I'm like, oh my God, I'm inflamed all the time. You could be inflamed all the time. The other thing is basic walking, right? Just walking and moving around, I heard that that's really good for people. And
Yeah.
we're very sedentary. Like, the kids, they're like, "Hey, you always park far in the parking lot, when we go to the grocery store." I said, "Yeah, I don't want to be like dinged by a car or whatever,
Yeah.
but we can walk. We don't have a handicap sticker on. We can move around." So, I love that around the movement. And I love that, it's not too often that you hear a medical physician talk about mindfulness and prayer and that. So tell me a little bit more about your experience with that and how you feel that affects people in their health.
So I think when you think about our life, right, in this crazy world that we currently live in, um, we still have that basic programming, right? So the basal part of our brain, the amygdala, the part of us that is works on a fight or flight kind of behavior, it was very important to the survival of our species years ago. It's like we had to make quick decisions and we had to make the decision that was most likely to move us out of harm's way, right? And that is still there, right? But it doesn't manifest itself as like, I got to run away from a tiger, right? It manifests itself as like, okay, I watched cable news and they told me how the election is going to be the worst thing ever because this person's doing this, or like, I went on the news and there's a World War III is about to break out, right? I had a fight with my boss. I'm worried about paying my taxes. Like, what's going to happen when the rent's due? Like, whatever, like all these things that like we're constantly thinking about in the back of our mind. We're worried about like, how is it that I'm going to avoid harm, right? And it's usually not harm in the sense that someone's going to come into my house and murder me, or I'm not going to get attacked by a lion, because those things don't typically happen. But you're worried for other reasons that are less tangible and less out of your control, right? And so if you allow yourself to get swept up into the mental movies that we play for ourselves, right? I say like your thoughts are not reality. Your thoughts are a reflection of reality. And just like any reflection, there's distortions. And just because it came out of your own head doesn't make it real.
Mm-hmm.
So, how is it that we can start to get comfortable with analyzing our own thought processes so we don't get swept up in the mental movie that our thought processes create? Right. And that's a talent, right? That's a skill. That's why we call it a meditation practice, right? And meditation is just one of the few ways that you can start to become familiar with the sequence of, I have a thought that generates an emotion that causes a reaction, right? And those three things usually happen very quickly, right? But someone who meditates on an ongoing basis can create space between the thought, the feeling, and then the reaction, right? And that gives you a semblance of control that you might not otherwise get if you just allow the basal parts of our brain to sort of get activated, and then we act on those instincts. That's when we get ourselves into trouble. That's when we get into fights with our spouses, or we say something stupid to the boss, or whatever it is that you did it. Like, you just torpedoed yourself and you didn't even realize you were doing it because you were just working off of this basal function.
That's awesome. And that's what I work with my clients, my coaching clients, very much on thought habits and being the observer of them for sure. So,
Yeah, it's
um,
like Eckhart Tolle's kind of like thing is like, be the observer of your thoughts, right? And realize it's something different than your conscious experience.
yeah, 100%, 100%. So now I was curious about this when we had our conversation about our thoughts around hormone replacement therapy. I'm like, I'm 52. Like, is this I went to a doctor probably about 10 years ago, and I'm like, hey, maybe this is something I need that, like, well, you got a lot of hair on your chest. You're this, you're all right. You know what I mean? That's basically what he said to me. And I was like, oh, okay. See you later. And I don't necessarily like had my T checked a while ago. I haven't done it in a while. So tell me what's going on in the world of hormone replacement therapy for men. I know you talked about diet as being this, some one of the foundations. Let's look at these things before we go there. Is hormone replacement therapy kind of a quick fix for a bigger problem, or is it the result of some of the problems that we occur in our environment? When you and I have talked about that, just about all the toxins in our food and chemicals and the things that we're exposed to. Tell me a little bit more about your experience with the hormone stuff.
So I think with testosterone replacing, because now if we're switching into like kind of the male, we spent some time on the female aspect of it. The male aspect of it, I think, um is 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 important. It is something we see often. I don't think that going on testosterone replacement or doing something to augment your hormones is just like a patchwork for something else. Because again, if we go back to those two index patients, right? So, first patient, the guy that's healthy, diet's on point, they're doing everything right. I check their levels, right? Now, here's the thing: if they go to their doctor, like their traditional doctor, and they get their lab work checked, they might be like, okay, well, your testosterone's normal, so nothing to see here, go on your way, right? That's not the way I approach it. I first ask the patient, like, what are your symptoms? Like, what brought you in here, right? And if they start calling off specific symptoms that I think key into low testosterone, I'm like, let's approach this with a sense of curiosity, right? So those things are, my energy is depleted, my mood is disrupted, sexual function, libido are disrupted. Oftentimes there's sleep derangements, brain fog. And like, if I'm hearing these things, I'm like, okay, this could be a low testosterone. Let's go through the rest of your health history. And when I'm like, I don't really see any like major changes you need to make in your life, let's go ahead and look at your testosterone. And then you might find the person's testosterone is normal or low normal, but they have binding globulin, which is this thing that kind of sequesters testosterone that could be high, that then creates the amount of available testosterone to interact with cells low, right? So you're like, okay, you're functionally low testosterone because your total testosterone isn't great. And the low testosterone is being made is being basically locked up so it can't interact with your cells. So what can we do about that, right? And there's several options that people will have. But in that case, I don't feel like we're putting a bandage on someone because they're already doing all the things, right? Um, and then those people benefit from testosterone replacement. And for them, maybe part of the reason that they're having this like less than ideal number is because of things that are completely out of their control, right? The multiple chemicals that are in the United States that are outlawed in other parts of the country. And there's something like 9,500 things that the United States allows that like Europe doesn't. Like that's a lot of chemicals, right? Or there's a lot of plastics in the environment, right? And so when you look at these plastics that are in the environment, like I forget there was some study that said like 100% of placentas they look at had microplastics in them. And plastics often have an estrogenic effect. So like as men, we're walking in this kind of like stew of like all these particles around there that have kind of a drag on the testosterone and create more of a kind of an estrogenic push for us. So it's like that may be something you can't really overcome. And if we add testosterone into the mix, or we use a medication to sort of coax your body to make more of its own testosterone, we can raise those testosterone numbers up and put you into an optimized range, right? And that's the difference that I have with a lot compared to like a traditional provider is that we're not looking for pathologically low testosterone. We're looking for, do you have symptoms that correlate with the testosterone that isn't right for you? And if we
Mm.
bring your testosterone to a more optimized level, that all those things that you're like doesn't seem right, all of a sudden get right relatively quickly, like within a month, people can start seeing benefits by optimizing their numbers, right? So that's where it's like, yeah, I don't feel like we're putting a bandage on someone. Now, if you flip the script to like index patient number two, the guy that's got nothing right, that guy's going to come in and be like, yeah, but I don't have the energy to exercise, and because I got all these other medical problems, like I just got this huge hormonal headwind, and I want to make changes, I want to do all these things, and I'm going to do those things, but man, it is so hard because when I've tried it before, it hasn't got me anything, and I'm like, yeah, that's because you have this. Not only do you have all this stuff against you, you've lacked the motivation and the internal biologic, like optimization so that you start getting benefits from the work you're putting in, right? And so that's a person I might put on testosterone to get their numbers to a more optimized range so they can reap the benefits of the work that they want to put in, right? So is that a band-aid? I
Mm.
mean, I guess maybe it's a band-aid. I mean, you could do two things. You could say like, look, sir, you need to clean up all this stuff first. So get out of my office until you come back and your BMI is ideal and you've cleaned up your diet. And then if you're still low testosterone, well, then we'll talk about it, right? And that's often what happens in the traditional world of medicine is like, we're like, it's not an option for you until you clean up everything first, but
Right.
people lack the motivation to do that. So it's like, okay, if you come to my office, right? And we're going to have a conversation. We're going to give you a pathway that you can start following to make those changes. And then we're going to remove the testosterone, like low testosterone barrier, so that you're going to magnify your results. You're going to optimize your benefit. And I've had a number of guys that came in unhealthy. They're usually on the younger side, like in the 30s, right? That
Mm.
did all those changes. And they're like, I feel freaking fantastic now. I'm the best shape of my life. Like, do I still need to be on this stuff? And I'm like, you know what? You might not be. Let's see if we can get you off of it and graduate you from BioRestore, right? And I've had a number of patients that we've weaned down their testosterone, have provided some medications to kind of help kickstart their own production of testosterone, and then have weaned that medication off. And like we have a follow up 6 months to 12 months later, and they're like, I'm off everything, and I feel great, and I changed my life, and like I needed this. Thank you very much. And I'm like, you're done. Like go with God because you know where to find me if you need me again, but you're doing everything right and you don't need the hormonal support anymore, right? That's usually like your 35-year-old guy that's like let himself go. When you're like a 55-year-old guy or a 60-year-old guy or a 45-year-old guy, now you're up against a couple things you don't have control over, right? Because even if you do everything right, you're still up against time, right? the changing genetics, the sort of decrease of testosterone over time, and longer exposure to that world of chemicals and crap that are dragging you down. And so I find that like kind of no longer needing to be on hormone replacement is something becomes less and less likely the older you are when you start on it, because you're up against time and a long history of having a hormonal drag.
Man, I love what you just shared. I love, that I'm gonna say younger person, they need a kickstart. They're feeling it, and then it drives them to want to do better in other areas. And then when you started talking about the 55s, I'm the 52, and I've got some mindsets in my head it's starting to shift. Like, I'm like, hey, I'm relatively healthy. Are there a few things? Yeah. But now that I've started to do some research into some of the things that you were talking about, and I shared that podcast on the things in our environment, in our food from the other countries, they don't have these ingredients. Like, not that I eat Lucky Charms by any stretch. When I was a kid, I ate Lucky Charms, right? But like, our Lucky Charms has all these crazy ingredients in it. You go to Canada, it's got like seven, right? And it's just mind-boggling that this is in our food system, and the plastics, and it got me wondering. I'm like, wow, this has caused me some challenges when I used to, in my mind, here's the mind judgment, be like, man, people are just more sedentary. I'm blaming us with devices and all this stuff, which may be true. But when you see, like, at the beach, just people are just chronic disease, and it's got to be more. There's got to be more to it. So now my mindset shift, and I'm like, maybe I need to look into this, because it is brain. I do have brain fog. Grant, I have brain surgery, and I do feel tired, and what's your take on coffee? I got to put that out there.
So I have coffee, right? But like I always ask the patients, well, like because most people are like I have coffee in the morning. I'm like, well, how do you have your coffee, right? I think there's a couple things. There is amount of coffee that you consume, and then there is the are you a metabolizer, right? Some people are fast metabolizers of coffee and it doesn't have any effect on them. Other people are slow metabolizers of coffee and the effects may be longer lasting. Then the question is, what do you put in the coffee, right? Like I've had patients who are like, I'm not going to give up my morning coffee. I like the sugar and like the most disgusting, like, you know, coffee creamer you can get, and it's just delicious and there's no way I'm giving that up, right? And for me, like I used to be like that. Now I have my cup of coffee with like a sliver of grass-fed butter, and sometimes I add like a little bit of coconut oil, or maybe I'll put a little bit of cinnamon in there, right? So I do something to change it up, and but like I take it black. I don't add sugar, and I don't add those coffee creamers.
Yeah.
um and I think you gotta say like, okay, how does it affect you? And if you're like, you don't know, why don't you try not drinking coffee for like a week and see how it goes, right? And then like add it back in. Is it a benefit for you? Because it is a plant phytochemical that has effects on people. And the effect that it has on me might not be the effect it has on you.
Yeah, and I've been drinking it for a bit. And I took a break when I had my brain surgery, and I was like, I was good. I was good. And then I'm like, this is my first coffee of brain surgery. I was like, oh, and then I'm back in it. But I drink it like you. I either drink it black, or I put some grass-fed butter. I do kind of like that bulletproof thing.
Mm,
And I studied coffee. Like that, I was listening to Dave Asprey, and he believes that there's mold toxins in coffee. You
mm.
know what I mean? And that causes more of the crash. So, he tests his bean. So I'm like, oh, okay, this is the bean. So I'm all into this. But so again, I'm really fascinated by this. So, what's your take? I'm going to ask you on some controversial things that are in our world, and people talk to me about this all the time. I used to do some health coaching, and people struggle with the proverbial "I need to lose weight," right? And now
Mm.
with this GLP-1s on the market, and they're seem to be prescribed all the time for everyone. What's your knowledge, and what's your viewpoint, I should say, on how that is for people that may be considering it, that are just having a hard time with the diet, kind of dieting or changing their diet? What kind of things would you recommend for people?
Okay. So we do some medical weight loss in our office as well. Um, but I never use the people come and say I have a weight problem, I'm quick to stop them on it. I'm like, you don't have a weight problem. You may have weight that's a problem, but you don't have a weight problem, right? What you have is a you're not healthy problem. And if you figure out what's wrong with that, your weight will fall in line. The theory is that for any given person, their age, their genetics, their what have you, that for any level of health that you've achieved, there's a weight that mirrors that, right? And so your ideal body weight for having ideal health at say 20 isn't going to look like what your ideal body weight is going to be for ideal health when you're 50. And you have to just kind of own that, like, life is a transition and that you're changing. However, if you have a weight problem, it's usually not a weight problem, right? It's a what are you doing to yourself that's causing you to be unhealthy? And then the side effect of being unhealthy is having an unhealthy weight. So much like testosterone replacement or hormone replacement, we spend a lot of time going into like, what is it that creates a healthy human? And we go back to those four pillars again. And a lot of it has to do with diet. But what's interesting about people that struggle with weight, there's usually a psychological component to it where food is a compensatory mechanism, right? People eat not because they're hungry, they eat because they're masking a feeling, right? And so we begin to have to break down as like, what is your relationship with food, right? What is the reason that you're eating food? How do you designate food, right? Because the problem is a lot of people say, well, I'm overweight because my genetics and it's just the way I am and there's nothing I can do about it, And I say that's not true. Or like I'm hungry, so I have to eat. Right. And because but I'm addicted to food. I know that I'm addicted to food. But unlike an alcoholic, I need to eat, but like if I was an alcoholic, I don't need alcohol. And I'm like, that's like an alcoholic saying, well, I'm thirsty, so I need to drink something, so I drink wine or drink beer or drink scotch. Like the problem is we don't break down food and realize that there's food that's of two types. There's food as nutrition, right? And then there's food as entertainment. And
Mm,
I tell people you need to start thinking that the first thing you can do is before you put anything in your mouth, before I ask you to change a goddamn thing about anything that you do, I just want you to change one thing, and that is be conscious of what you're putting in your mouth and ask yourself this question. Are you eating for entertainment, right? Or are you eating for nutrition? And then
mm.
at the end of the week, do a survey. How often did you eat for entertainment? And how often did you eat to nourish your body? And then start to change those parameters, right? Because someone who generally is very obese, they're eating for entertainment, right? They're eating to mask feelings. They're eating because they're looking for the best tasting thing that they can possibly put on their mouth, right? Not I'm looking to try to put the best thing I can to put in my body. Right. And so then you start kind of breaking down what is the underlying mental kind of blocks that are causing you to eat in a way that's self-destructive.
I
Right.
love it.
And then people say, well, what am I supposed to? I'm like, I don't want you to eat the best tasting thing. Right. But realize that it's not about you have to eat, because I've never seen someone morbidly obese who's addicted to garden salad and grass-fed steak. It doesn't happen. Right. But someone who eats all the processed foods out there that are high in calories, high in palatability, but completely devoid of nutrition, right? You're someone who's overweight and malnourished, right?
Yeah.
You may have plenty of calories, but you don't have any of the nutrition, and your body's failing you because you're not giving it what it needs. And your body's telling you that I need more stuff, but that translates to your brain like I'm hungry. So what do? You go back and eat more of the same garbage food. It's like having an abusive lover. You're just going back and getting abused again. Like, stop doing that, right? You need to start saying, like, what are the most nutritious things I can choose and start eating those. Even if you do it one meal a day, start by one meal a day. Just have nutrition, like a nutritious breakfast. Just start with that. And then you can do whatever the hell you want for lunch and dinner. But just start by making a change, because we're going to build on that as time goes on. Right. And so, we have those same conversations and begin to deconstruct the behaviors behind eating and why you're eating and what you're eating, and starting to qualify food as entertainment versus nutrition. Sometimes I say food is medicine, food is addiction, right? So we can begin to broaden those conversations about what you're putting in your body and why, right? Maybe you're eating because you're actually thirsty, right? Before you put something in your mouth, really get into it. Check in with your body instead of just being in your head, and ask, why am I consuming this? I'm consuming this because I'm sad. Okay, can you make a different choice? Actually, I'm thirsty. All right, so go drink some water and then figure out if you're still hungry 10 minutes later, right? Those are all little things that you can do that begin to shift the mindset around food. Now, if you want to use something like a GLP-1, that can be helpful. The reason why these medicines are so powerful is because the vast majority of people that are obese in this country are obese because they've developed insulin insensitivity, right?
Mm.
They've taken physiologic pharmacologic doses of carbohydrates on an ongoing basis that the human physiology was never designed to deal with. And the result is you break your pancreas, right? And when the pancreas breaks, or specifically the insulin response system breaks, your insulin levels start going higher in order to keep your blood sugar well controlled. Most doctors look at your blood sugar and say if your blood sugar is normal or high normal, you're okay. But if they looked at the insulin level, that might be way up here. They're like, holy crap, that's diabetic levels of insulin, even though your sugar's okay, right? That high level of insulin prevents you from being able to lose weight. So now you start gaining weight. Right. And so with the GLP-1s, it's doing a couple things. The sort of touted mechanism of action is it slows down the digestive tract. So you have an appetite suppression, and it does that. Right. And if your appetite is suppressed, you're less likely to make the emotional choice regarding food. Right. The next thing that it does is that it increases your insulin response. So you're able to mount a better insulin response in the face of a glucose load, so you can lower your sugars better. That's why we use it for diabetics. What's probably happening on the back end though is that your insulin sensitivity is increasing. So now in the background, when you're fasting or haven't eaten for a while, the insulin levels actually come down lower, right? And then that unlocks the ability to lose weight. So now you're coupling eating less, hopefully eating more with intention, improving the insulin response. And last but not least, it hits the central nervous system and begins to blunt some of that reward reflex that you have when you eat something that's, engineered for hyperpalatability and to give you that dopamine hit. Right, that gets blunted. So now you're making less choices about like, how is this food going to make me feel? And you can use this more intelligently. Throughout that course of time, you can start changing a way a person has a relationship with food, so with the intention that someday hopefully you can get them off the GLP-1 and set them loose based upon their new kind of relationship with food.
Mm.
Right. And so that's how I kind of structure it. The problem is there's a ton of places out there that are clinics that are like, hey, come in and get the skinny shot. Right. And what you're doing is you're automatically creating this idea. If you come in and you take this medicine, you're going to get skinny. So what happens? People come in, they don't get the education that I just gave you in a nutshell, right? They take the medication, like, this is fantastic. I'm not hungry. I don't have to eat. So what ends up happening? They become a malnourished, skinny person,
Mm.
right? Slowed gut, big other problems. And yeah, they lost weight, but they made losing weight the goal. That's never the goal. Being healthy is the goal. Weight will follow. Right. And so now they use a shot and they become 100% dependent upon the injection for the outcome. And as soon as they come off the medication, they go back to doing all the stuff they did and they become a heavy person again. And all they've done is created a yo-yo. So if you use a GLP-1 with the intention of changing your lifestyle and behavior around healthy living and a healthy diet, it becomes a medication that can accelerate you to the finish line, but not a medication that you become dependent upon for the rest of your life because you didn't make any changes where it counts.
Are there certain criteria, like for people that are out there thinking about it, is it for the person that is a certain weight that like, hey, you know how weight loss surgery and all the band and all that stuff was like, hey, I remember when I worked in the ICU when they first started doing those and they were on people that were 4, 5, 600 pounds. They used to have a strict protocol coming to the surgical ICU where I worked. It was a very serious thing back when it first started kind of coming out and all that. Now, are these recommended for people of a certain kind of weight, or is there a certain criteria that they should be used in your thought? Because, like you said, everyone's like, "Hey, I want to lose 30 pounds, and I want the easy way, and I just want to do it," and they're not really focused on the health change of it. So, what's your thought on that?
So again, when I'm not trying to work through the like insurance models to get it paid for and are they not, like, it frees you up to be a little bit more um to be able to experiment a little bit more with different options.
Mhm,
So certainly a person that comes in that's obese, like morbidly obese, like almost always there's metabolic dysfunction there. And I think these medications help those people because it gets to some of the underlying issues regarding the disruption of the insulin response pathway.
mhm.
So but again, now you're also having to deal with that aspect of why people are eating the way that they're eating. So there's a lot more work we have to do to deconstruct their behaviors. Because when someone's morbidly obese, there's a lot behind that that got them to that point that you have to start breaking down, right? And it's a long road back. But I don't think that disqualifies you. At the same time, I've actually used this medication on people that you would look at, be like, that person doesn't need it at all, right? And I get very careful with that because someone's like, I'm doing all this thing right, but I still get like an extra 20 pounds that like is just stubborn, right? And you look at them, you're like, you're not like, you don't need to be on this medication. They don't need to be on the medication per se, but can you put them on it for a short period of time to get them to like an even better level where like their lean body mass is now further reduced, right? Because in doing so, you can really help restructure how people look at and deal with food. Right. And to me, that's where the benefit is, right? It takes by taking this medication, you can blunt that like more primal drive to consume, sugar for sugar's sake or carbs for carb's sake, and give people that little bit of a beat, that space. It kind of is similar to like with meditation, where like you do this internal practice where like I have a feeling, right? Or have a thought, creates a feeling, there's a response, right? And diet and in food, there's this idea of like, I'm hungry, I want to eat, and you go eat something, right? And if you can create space between that, like I'm hungry or I'm not hungry, but I know I need to feed myself, what am I going to choose if I'm not just trying to eat something to like satisfy my taste buds, right? And so people are like, okay, well, like I know I need to eat something, so let me take the time to create something that I know is going to be healthy. Because if I'm going to eat less food overall, I want to make sure the food that I do eat is has all the nutrients in it that I need. Like that is a powerful skill to develop, right? Because maybe you're eating twice a day as opposed to 3 times a day, or eating once per day like now you're like, but I know I have to eat for nutrition. So how do I do that? Right. And so for someone that like, okay, they're only trying to lose like 10, 15 pounds and they're already like really good shape, like that aspect of learning how to eat for nutritional optimization is a really good skill to have, because then when you withdraw that, those behaviors have a tendency to continue.
Wow, that's powerful. That's powerful. Using this as a skill that's learnable, right? And practice. And I think, yeah, that's what I work with my clients in from mindset. And I'm like, you really have to rehearse this way in your thought processes so you could start to integrate this and practice. I think for me too, like I'm a little older, like, oh, I should know this. I should, instead of like, hey, I'm learning something new. I need to practice. I need to, like it's fitness, right? You don't get fit in a day, right? Even spiritual fitness, right? They use the term spiritual fitness, right? It's not like, a foxhole prayer, like, oh my God, help me out. It's a mindfulness, it's a practice that we need to cultivate. I love a lot of the stuff that you talk about. So, I know that we talked about it and you covered so much. I had a couple little notes that I wanted to talk to you about. One of the things we talked a bit about the toxins, we talked about health, we talked about the hormones, your pillars. Now there seems to be the chronic disease of obesity, and this may be a totally different topic, but I want to see if this comes to you in your practice. People are talking about a lot of anxiety and depression, ADHD. When you have somebody that comes in and starts to report those things, what are some of the first things you're looking at? We know that counseling and all those things are helpful, but from a health perspective, what kinds of things come to your mind that you start to talk to people about? Like everyone's like, ADHD, I have anxiety, and then I go to depression. And one of the things, and I'll just share my experience, when I really cut some of the inflammation in my body, I noticed that my brain got clearer and I was less maybe anxious. There was less downs a bit. And it was like this veil was lifted off my eyes from a cognition type of perspective. What types of things do you see?
Yeah, so I think mental health does creep into here in a lot of different ways, and I wonder if a lot of the diagnoses that are out there about anxiety, depression, and ADHD and these kind of things that you mentioned, certainly there's a portion of those people that need counseling and need to be on pharmaceuticals to help balance that stuff out, right? But I think there's a portion of people where those diagnoses, like those symptom collections, right? Because that's really what it is, right? It's not like there's a blood test for ADHD. Right?
Right.
It's not like there's a blood test for anxiety. Like you say, like, how are you feeling? And what do you tell me what you're experiencing? And you're like, then you go to the DMSM-4 and you're like, okay, well, if you have those symptoms, you have this thing, right? It's not a disease, it's not a diagnosis, it's a description.
It is.
That's what it is, right? And so the question is why, right? And so for you, like, okay, maybe you really have an issue with like your serotonin balance and you need to be on an SSRI to help get that rebalance. And there's nothing wrong with that. And if it makes you a better, happier, more functional person, then go for it, right? That's great. But what if a portion or the entirety of your symptom your symptom set, which exists in the kind of the mental space, is the result of a physical problem? Right? Can we do things like optimize your diet for concentrating on a low inflammatory state so that you get your gut to calm down and then your brain comes down and then these things get better, right? Maybe they resolve entirely, right? So that's an important aspect of it. I think I've had at least a number of patients that were diagnosed with depression, that it was low testosterone, right? We put them on testosterone replacement. And they're like, I'm not depressed anymore. I was able to finish to get rid of my SSRI, right? So like you have to be willing to realize that like it's not black and white. Like there are different aspects of it. But I think across the board, whatever mental health issue you have been labeled with, right? That's okay. But realize that even if it's not entirely dietary related, do things to optimize your health, starting with those four pillars. Lay on supplements to cover gaps in nutrition. Get your hormonal health on point, and then see how much and how severe those mental health symptoms that you have are still there. Because you might find that those symptoms are minimized or maybe alleviated altogether because you just started to be a healthy human rather than someone who ignored all the things that create a healthy human. And then you add another chronic disease on top of it. But this one happens to be a diagnosis of a mental illness.
Yeah, I agree. Because it could be a symptom, but it could be, hey, you're feeling down, and there was some things I've struggled with in my world, and I've gotten some mental health around that. But I also realized too that the gut and some of the things that I was eating and the inflammation in my body and just feeling not so great. You get depressed about it, or even chronic pain. People that have a lot of pain, that affects their mental status. So I got a quick
Yeah.
question on, you mentioned
Well,
supplements a couple.
I was gonna say, just going back, if you want like a real world experience, like my wife
Yeah.
has had chronic asthma, was on, inhalation steroids, and was on like albuterol, and she was using that stuff all the time, right? And as I was going through this journey, trying to figure out how to counsel people, like our diet in our house changed. We went way away from carbs, and I'll tell you, when that happened, she's like, all those aches and pains that I had in my back and my neck and whatever, as everything was always hurting, doesn't happen almost ever, right? She was able to stop her steroids. Like she like cured her asthma with diet.
Wow.
Like, I mean, like she doesn't take an inhaler anymore. She's like, I don't need it. Like, okay, if she has like a bad respiratory infection, like she might take some albuterol, but she has not taken inhaled steroid for her asthma in over a year. And the only thing that changed, other than a little bit of hormonal manipulation, was that she got rid of all the crap in her diet that's inflammatory because she's super reactive to a lot of these foods. Right. And I can see that there's a difference with her. Like she has some bread, her face turns red. I have some bread and like, cheat here. And I'm like, whatever, I'm fine with it. Right. That's bio individuality. But realize that like these choices that you make in terms of what you put in your mouth have consequences. They're calories with consequences.
I know. I touch bread, I'm a disaster.
Yeah.
I'm a mess. It's like, and I'm like, oh, I got a gluten thing. It's all that stuff that's in the bread, and I have to really watch my carbs. So, um,
Yeah, you
what?
mentioned something about supplements. You were gonna, and
Yeah, the
then I cut you off
supplements.
there.
What are some of the key supplements that you feel that the guy, like you said at the beginning, the guy that comes in that's, you know, hey, I'm a mess. I got to change my diet. What are some of the core things that you feel people really need?
Um, yeah, so I always tell people if you're gonna take a supplement, have a reason why. Like, don't take a supplement because you heard a podcast and someone said it was a good idea. So again, I'm about to like sort of like like give the advice opposite of what I just tell people, but you have to have a reason. for that, right?
Hmm.
And so for me, I put supplements in kind of three distinct categories. The first category is what I would call filling nutritional voids, right? And that comes to the recognition that, again, our food sources are kind of terrible. We live in a low-key toxic food environment. And even if you're trying to do everything right, like like unless you're like, you have a victory garden in your backyard and you're farming your own stuff. Like, I go to the supermarket, I buy broccoli there, and I know that broccoli was probably grown in soil where the nutritional value of that soil has been depleted over time, right? There's not as much good stuff, and even the good stuff, as there was 50 or 100 years ago. So there are nutritional gaps that are often can be filled through the use of supplementation. So supplementation to fill nutritional gaps, that's category number one. Category number two, supplements to target a specific issue that you as an individual have, right? An example would be, let's say you have some arthritis, and so you decide to go on some sort of curcumin or turmeric type supplement because it has good anti-inflammatory properties, or you're taking cinnamon because your blood sugar's messed up, or you take cortisol because you're under a lot, or an adrenal support supplement because you're under a lot of stress, and so you're trying to get some ashwagandha and L-theanine in your system. Like, now you're treating a specific issue. The last one I would put supplements that are, felt to have some sort of longevity benefit. Like, you're not necessarily going to feel anything, but if you take it, like, it might help you live longer, kind of stuff. And that's kind of like the last category of supplements. So if you go back to category one, filling nutritional gaps, what makes sense, right? The first, I take a multivitamin. This is what I do myself. I take a multivitamin every day. Why? I realize that I eat pretty good, but I don't eat perfectly. And even if I were eating perfectly, I'm probably missing some key stuff. So I take a so I take a multivitamin to cover my bases. It's one. Two, vitamin D, right? Specifically, other than states where we are, everybody, and I mean everybody, rolls into my office. I check a vitamin D on everybody. And everybody that's not on a supplement, they're either like downright pathologically low and like borderline at risk for rickets, right? Or they are like suboptimal, right? And so I tell everybody, around here, you should be thinking about taking vitamin D, and you're probably going to need to take in about 5,000 units a day, right? That's the difference between a dose to prevent deficiency disease, right? That's the recommended daily allowance that we have and kind of all our things, right? The FDA was like, this is the recommended daily allowance. And what they mean by that is, how much does the bare minimum you need to not get a deficiency disease? Whereas something called an orthomolecular dose, which is a dose that is necessary to optimize those numbers for optimal human function, that's a little bit different. I find an orthomolecular dose for most people in the Northeast is around 5,000 units of vitamin D a day. So that's number two. Number three, omega-3, right? Fish oil, right? Or omega-3s from other sources. Why do I like omega-3? Because it's a necessary thing for our physiology, and we don't make it ourselves. We need to get it from dietary sources. The best dietary sources for those are things like organ-based meats. So if you like to eat liver, you like to eat heart, you like to eat bone broth, you like to eat a lot of fatty fish, probably don't need it. For me, I'd rather have a fillet when I'm like having a steak, right? So for me, like, I take a omega-3 to shore up that. A probiotic is something that I think is helpful for a lot of people that have digestive issues. For me, that was one of the first time I started on a supplement, and I was like, "Holy crap, what have I been missing?" Like, for me, I'd had gut issues my entire life, like my entire life, and I went all the way through medical school and surgical training, and like, I walked out of there and I'm like a newly minted attending surgeon, and my gut was still messed up, and my PCP that I met for the first time was like, "Dude, why don't you try a probiotic?" And I was like, man, I don't know about this. I'll give it a shot. And I was like, it changed my digestive health that I've been dealing with for like 25 years within a month. Right. Now, that's not going to happen for everybody, but for me, it was the first time I'm like, hey, you know what? Not everything that is good for human health did I learn in medical school, because this wasn't on the curriculum and it was hugely beneficial. So I often will recommend the probiotic as number four. Two more that I like: a B complex vitamin, right? The B complexes are really important for liver functionality, liver metabolism, fat metabolism, etc. That's the way we primarily clear out toxins. And I like to support my liver health by taking a B complex vitamin, because a lot of people are suboptimal on those. And the last one I use myself is magnesium. I usually take it at night before bed. I use a bioavailable form of it, and that helps kind of get me into a relaxed state, so that it's helping with sleep, and it gives me some of the magnesium that's lacking in the diet. So those are kind of six supplements that I kind of take on a regular basis, and then I have other ones that I lay on that. For other issues, I take the adrenal support supplement that's been hugely beneficial for me, and then I kind of play around with different stuff for like mental acuity and longevity stuff, and those I kind of switch around and play around with and try to take a beat on, like, okay, I've been on this thing for a month, what's my thoughts, is this worth keeping or should I try something different?
Wow. Well, man, that's packed because that's the core I do.
Hmm.
And
Hmm.
then I'm big into gut health, so I definitely look at probiotics and I've researched some ones out there.
Yeah,
So
four categories of probiotics I tell people about, right? And depending on how bad your gut is, you may want to take one from all four of those categories. So if you want to do a little sidebar on probiotics, I can talk about that as well for like gut health.
do you have time now or is it we need a whole
No,
nother.
no, no, I'll just do quickly, right? Most of the time when you roll into a store, you're going to see and you pick up a probiotic, like 90% of the time it's going to be a lactobacillus and bifidium blend, right? And you might have one or two strains, you might have 20 strains, but it's usually a combination of that, right? So that's like your typical standard probiotic, category number one. Category number two is what we call spore-based probiotics, SPORE, and those are usually bacillus, right? And so those are ones that are often refrigerated, but not always. So if you see bacillus, variety, that's kind of a second category. Third one is actually like a yeast. It's called Saccharomyces boulardii. That's a third one that you'll see kind of in there. So sometimes you can do one from each one of the categories if you really want to have a robust probiotic um, kind of support. And the last one that actually just came out by a company called Pendulum Health actually has something on it called Acromantia, which is kind of a newer probiotic, and I think they're the only company that has that in there. So if you wanted to add a fourth one, you could add Pendulum's Health GLP-1 probiotic support and get Acromantia there as a fourth category. So those are kind of the four different kind of like columns of probiotic. I take a combo between the basic one, Lactobacillus and Bifidium, that also has Saccharomyces boulardii in there, and that's my basic thing that I do. If I, had to take a course of antibiotics, I might add a couple one of those others to replace what I lost when I killed them with the antibiotics.
I love it. Yeah, I do the acromantia from Pendulum.
Yeah.
I do that with a standard. But I'm a huge believer in the gut health for sure. So man, you have given us so much information and some of the things that you're working with on patients and some I think a lot of people just a confused mind, like I said, does nothing. And I think in this conversation, there was a lot of mindset shifts, a lot of things that tools that people could use to help them get to this, start taking their health into the kind of the next step. Now, for somebody that may be listening, that's like, I really need to do something. Not they haven't been crazy serious about anything. What do you think they should like start to do? Like, what's your recommendation?
So usually if I'm seeing someone, I say, look, choose one of those four pillars, right? And for the most part, it's usually diet. I think that's the one that has the biggest impact if you make significant changes in there. But
Yep.
choose one and make some change and make some changes in that. And I usually will counsel people on that. Um, for like sleep hygiene, there's things, but I think you got to choose one of those pillars and then become curious and become your own advocate and start doing some research. And if you're like, man, my sleep is terrible, start doing some research on like what is it that I can do to improve my sleep quality. If you're like, I know my diet could be better, then start researching that and just start trying stuff. Because as much information I have in this head of mine, like everything has to be done through the prism of what is it that works for you, right? I can give you some tips and tricks and I might be completely wrong because I can't account for all the things I can't account for. But you got to start trying and you got to have approach it with a willingness and a curiosity to be like, if I make this change, what will happen, right? And realize that those changes always can be made. The question is do you want to make your health something that is you don't care about and you just let happen passively? Or do you want to take health and make it the offensive and defensive sport that it needs to be? Because it is a full-time job to stay healthy, because our society is set up in a way to let you have ease, convenience, and eat things that are super tasty. And if you follow the path of ease, convenience, and taste good, you're going to get sick. It may take 10 years, may take 20 years, but you'll get there. And if you follow the path of like, let me put some effort into optimizing my health and investing into my health and seeing what I can do, it's work. but it's work that's worth it. Because let's face it, anything in this life that's worth having, you have to put effort in it. Whether you're building a business or you're working on your marriage, you're trying to be a good parent, it takes work, and your health takes work too. So put in the work and be healthy, or don't put in the work, but expect that you're going to be very sad at some point in your life, because health is the one resource that you have that trumps all others. Right?
Yeah.
People worry about money, and people worry about their time and how can I make more money. And the problem is that when you get to the point where you have money and time, but you sacrifice your health in the process, you're gonna be like, wasn't worth it.
Right.
Wasn't worth it. Right? Like, any person, you ask any multimillionaire or billionaire that's on their deathbed, right? If they could have their health back or give back all their money, what would they choose? And no one's going to be like, I want to keep my money and die here. They're going to be like, I wish I would give up everything that I had if I could just be healthy again.
Yeah.
Right? So
Oh,
make it a priority.
100%. For some guy that looked down the barrel of a shotgun, and I was doing hospice work, and I spent time with people that died, that were dying. And it's an interesting phenomenon. Like people, there were some people that were like, I really enjoyed things. I did well. And, like spent the time doing the things. And then you sit there and you're like, wow, we have an expiration date and nobody thinks about it.
I mean, I think about it all the time, but I think about it in the prism of like, when my expiration comes date comes, I want to be able to look back at all the things that I did and be like, no regrets.
No
I did
regret.
it as best I could, right? I made the choices that allowed me to be the best possible version of me every single day.
Yeah,
And when my time comes, if I can look back and be like, I made that choice way more often than I didn't, I did pretty good.
I love it. Dr. Stanizzi.
Yes. You got it.
I
See?
got it. I didn't even
Yeah.
look at it.
Mm.
It's been it's been a blessing to have you on. Now, I know you talked about it at the beginning, but if someone's interested in connecting with you, I know locally they could come into your office and we'll put all that stuff there. What states is New Hampshire and
So I'm licensed in New Hampshire and I'm licensed in Massachusetts. Those are the two places where I can provide services that include medications or some of the hormone replacement stuff. If it's outside of that and people are just looking for like health coaching, they want to have conversations that are a little bit more, you know, tuned into them, then they could call our office and I can talk to anybody about health and wellness aspects, maybe talk about supplements that aren't official medical recommendations, but start putting them on the path. So they can, go to our clinic website and we can have that conversation. BioRestore NH has a Facebook page. Med Evolution has a Facebook page that I just started that has some resources on it, that kind of have like a checklist for health, as well as like a health blueprint that talks a lot about these health and wellness choices, with some some clickable links in there that goes to our supplement shop that we have at BioRestore, and has some other affiliate stuff that I think is a value. So those are ways that people can start the process if they're just trying to look out. But I like to be responsive. I like to be of service to people. So call the office, shoot us an email, and we can connect up and see if there's something I can do to kind of start people on this journey if they're interested in taking the first steps.
awesome, awesome. Thank you so much for coming on the show. And there is a wealth of information here. I'm gonna re-listen to it again and uh and thank you.
Well, thank you very much for having me. I appreciate these opportunities, and again, um, I like to sort of spread this word. I think the more people that hear it, the more people start thinking about it, the more we can start um, making some positive changes in individual lives. But those individuals can maybe start holding, some of the other organizations that are major factors in how our health is sort of evolving or changing, and begin to hold those folks accountable, and start pushing back on on what's in the environment, start asking intelligent questions of their physicians and the people that are responsible for taking care of them, and start taking responsibility for their own health. And the more people that start getting in that mindset, we're going to start making some hopefully some positive impacts in the state of health in our country. Which to me, if like we can get to the point where like my job, what I do, is now obsolete, then I've done my job.
And then you could go out in that cabin in the woods, right?
Yeah, just sit back, relax, watch the sunset. Sounds nice, right?
You bet. Thank you so much, doctor.
All right. Thank you very much for having me, and enjoy the rest of your evening.
You too.